The COVID-19 pandemic has negatively impacted the mental health of many people in the general population. The mental health of pregnant and new mothers is of great importance because anxiety and depression can not only negatively affect the mother herself, but also the developing child. How has COVID-19 affected the mental health of mothers? Since COVID-19 was first recognized in late 2019, the virus has rapidly spread throughout the world. In an effort to mitigate the devastating effects of this virus, varying levels of stay-at-home orders have been implemented in most countries around the world. This has resulted in the closure of schools, daycares, workplaces, and non-essential services. The impact of the physical and social isolation on mental health is anticipated to be high and may disproportionately affect high-risk populations. Depression and anxiety affect 1 in 7 women during the perinatal period and are associated with increased risk of preterm delivery, reduced mother-infant bonding, and delays in cognitive emotional development of the infant, which may persist into childhood. Prevention and treatment is critical, yet it is estimated that 50% of women who are depressed remain undiagnosed during and following pregnancy. A study titled Moms Are Not Okay, COVID-19 and Maternal Mental Health aimed to assess the influence of the COVID-19 pandemic and subsequent physical distancing and isolation measures on the mental health and physical activity of pregnant and postpartum women. Between April 14th and May 8th, 2020, 900 women who were pregnant or within the first year after delivery were recruited to participate in an online survey. This included questionnaires on self-reported levels of depressive symptoms using the Edinburgh Postnatal Depression Survey, anxiety using the State Trait Anxiety Inventory, and physical activity. Current and pre-pandemic values were assessed for each. The Edinburgh Postnatal Depression Scale, EPDS, is a self-reported screening questionnaire consisting of 10 questions, which was initially used in the postnatal period. However, it is also commonly used during pregnancy. Clinical diagnosis of depression can only be determined by a trained health professional. However, a score of greater or equal to 13 on the EPDS is associated with a likely diagnosis of depression. The State Trait Anxiety Inventory, STAI, is a commonly used self-report questionnaire to screen for the presence and severity of state, that is, right now, and trait anxiety, how prone a person is to anxiety. It consists of 40 questions, and a score of 40 or higher has been identified as the threshold to identify clinically significant symptoms of anxiety. Physical activity was self-reported in 2 ways. First, participants provided an overall assessment of their achievement of 150 minutes of moderate intensity physical activity each week, which is a current recommendation for pregnant and postpartum women. Secondly, participants reported on physical activity during the week. The intensity of each activity was assigned a metabolic equivalent score. An Edinburgh Postnatal Depression Scale score of greater or equal to 13, indicative of depression, was self-identified in 15% of respondents pre-pandemic and in 40.7% currently during the pandemic. Moderate to high anxiety was identified in 29% of women before the pandemic, compared to 72% of women currently during the pandemic. However, women engaging in at least 150 minutes of moderate intensity physical activity during the pandemic had significantly lower scores for both anxiety and depression than those who did not. The findings of this survey illustrate a significant increase in self-reported levels of depression and anxiety and substantial reductions in physical activity in pregnant women from before to during the COVID-19 pandemic. Depression and anxiety are well established to have both acute consequences, for example, preterm delivery, attenuated fetal neonatal growth, and long-term consequences, for example, increased risk of future anxiety and depression, cognitive delays for the offspring, for the psychological and physical health of both mother and baby. Although clinical diagnosis and treatment via psychological or pharmacological treatment remain frontline therapies, the COVID-19 pandemic may reduce access and/or attendance to healthcare visits, which could increase the risk of maternal and fetal health complications. The findings of this survey suggest that remaining physically active could be a helpful tool for pregnant and postpartum women. Specifically, engaging in at least 150 minutes of moderate intensity physical activity each week was associated with lower scores on screening tools for depression and anxiety. Thus, physical activity is an accessible measure to blunt the mental health crisis currently being experienced by pregnant and postpartum women.